Hello and welcome to the I Love Me Lab show. My name is Gail Buck and I'm an NLP Master Life Coach, meditation instructor, and a seeker of happiness. And each week, we're going to bring you inspiring person or message to help you discover additional ways of self-care, self-love, and becoming a healthier, happier you. So thanks for spending time with us today, and let's let the show begin. Hello and welcome everyone to the I Love Me Lab podcast. And I'm so excited today to introduce you to my really great, dear old friend, Dr. Emile Allen. Hello, Emile. How are you?
Who are you calling old?
Old meaning a very, very long time that we've known each other. So it's so great to see you
Okay.
again.
All right. Well, I'll take that.
And you look like the same. You look the same as the first day I met you. So you look great.
So do you.
So I'm going to actually read your bio a little bit because it's kind of a long one and I don't want to mess it up. So Dr. Emile Allen is a former chief of urology and vice chairman of surgery at Scripps Memorial Hospital-La Jolla. He's a certified medical hypnotist and instructor and the creator of a proprietary drug-free pain therapy technique that uses the pharmacy within. And that's primarily where we're going to dig into, and I'm excited about on this podcast. Emile is a sought-after instructor, and he works with individuals worldwide, as well as teaching other doctors how to use his free pain therapy technique. And he is also an internationally recognized author and speaker. So welcome. Now, you and I met, I think it was in 2007. And I think it was just prior to you releasing your first book. Is that correct? Am I right on with that?
Yeah, that's true. Yeah, it was a few years prior to me writing my first book.
Yep, and it was before you did your TED Talk, and you had just kind of this whole shift in your life, really.
Absolutely. It was definitely an awakening and a feeling of empowerment, and I felt like I needed to get my message out to the world to let them kind of see what the journey that I went through in order to get to the place where I am now. And it continues to, the ball just continues to roll, and every day, every week, every month, something new comes up, and it's just momentum that occurred from way back then from my story.
If we can talk about that a little bit. So your first book was Eaten by the Tiger, Surrendering to the Empowered Life. So what was it what created, would you mind sharing your story of what created that big shift? What took you from being, the former chief of urology and vice chairman of urology in La Jolla?
Sure. So basically, I'm trying to figure out how to kind of weave into this because it's a continuous story. So we're probably going to have to start with the story, and then we'll go backwards, and then we'll go forwards where we are now today. So in 1998, when I was at the peak of my career, I was about 38 years old, and I was the chief of urology and vice chairman of surgery, and I was performing an operation on a patient, removing their kidney for renal cell carcinoma, cancer of the kidney. And during the operation, a piece of medical equipment malfunctioned and it couldn't find ground, and it happened to use me as the ground. The electricity went through my hand, up my arm, through my heart, through my brain, and out my left ankle. And I ended up dying in the operating room, and my OR team, that I was running, they saved my life and they got me back. And, to this day, eternally grateful to them. But it wasn't without some consequences. I had a traumatic brain injury, which back then, nobody knew what traumatic brain injuries were, and it was very hard to diagnose. And I ended up in the ICU for about a week, and then eventually I was having difficulties counting change or reading a book or maintaining my concentration. I had to close down my practice and move in with my parents who were alive at the time. And also I injured my left hand, and it was having a lot of pain with that. So I went through everything. I was going through hyperbaric oxygen treatments and nerve injections into my the brachial plexus to control the pain in my arm and my hand. I was going through occupational therapy and cognitive therapy and a lot of different things. And so during this process, it took about 3 years for the brain injury to get to its baseline. And it took longer for the hand injury. I still suffer from the hand injury, and I had to learn how to manage my pain drug free, because I was not going to go down that route that I'd seen so many patients go down, where they become addicted to opioids or non-opioid medications. And I just wasn't going to do that. So I did my best to learn everything I could about a variety of different therapies that are out there, alternative type of therapies, which none of them seem to work specifically for any very long period of time until I learned about hypnosis. And I kind of fell into that. I had been doing I got a mosquito running around here. I had fallen into hypnosis because when I was in private practice, I would use hypnosis quite a bit for my patients who would come into my office, and I would have to do, let's say, a little minor procedure in the office, and we use some local anesthesia for controlling the acute pain, and then also use some hypnosis to keep them calm and decrease their anxiety. And I was really amazed by how efficiently and how effectively it worked. But it wasn't until I had my accident, I went through the pain that I was going through on a daily basis, that I did not realize how much suffering people can go through. I mean, because I was really suffering, and I realized how much other people were suffering. And that's the key point that I would like to get to the audience, whoever is listening to the podcast, is that you cannot lump all types of chronic pain into one silo, like medicine has done. You have chronic pain, you go see the pain specialist. You have chronic pain, you got to take narcotics or non-narcotic medications to try to control it. You can't lump them in, because everyone's chronic pain is as individual as their fingerprint. Your pain would be different than my pain, or different from the person down the street. It's because chronic pain is the result of a lot of biological impacts. When I say biological impacts, I'm talking about psychological, physiological, and social stressors or impacts that happen to a person throughout their life that cause different behavioral responses or emotional responses that trigger the pain.
So it's not like if I went and smacked your hand with something and I smacked my hand with something, we're going to feel the same thing. It's going to be tied into a lot of other things that are going in our head and our background and things like that. Is that what you're saying? It's how we define what just happened or is about to happen?
Yes. And it's not in your head, it's in your subconscious. And so I was actually just speaking to a integrative pain specialist about a week ago, and he was saying how he would have patients that would come in to his office, and they would do different nerve blocks and things like that to these patients. And, someone would do really fine. And then you'd have other people that would come in, and they really were having extreme emotional reactions to having a nerve block, and the needle hadn't even been put into the patient yet, and the patient was already screaming, thinking that the needle had been put into the person, but the doctor hadn't even touched the patient. So again, there's stories that the person was creating within their, from previous emotional trauma or emotional experiences that they had, and they were already running the story in their mind before the doctor had even touched the patient, and that the pain level was going up. So based upon this, going back to my accident, I was going through a lot of physical and emotional pain. And right around the time that I was finally getting better, it's probably about 6-8 years later, and I was starting to get, feel better, and was working again and consulting and doing things. My father got diagnosed with metastatic lung cancer. And it took him about 3 years to pass away. But during that time, when he was getting sicker and sicker, and we knew the time was coming, all of a sudden, I started getting this pain in my right shoulder, the totally different opposite side of my body where I had my accident. I started getting pain in my right shoulder, and I got to the point where I couldn't get my arm above my head. I could get it to about right here, and I have this hard stabbing, acute pain right here in my shoulder. And I went to see an orthopedic surgeon. He evaluated me, and he thought I had a rotator cuff problem. And he wanted to get, some MRIs and some other things. And, I'm thinking, oh gosh, I know this is going to go. We're going to end up having an arthroscopy and have to look inside and see what's going on. I'm like, look, I'm getting ready to go to a retreat, a seminar, and I won't be back for a few weeks, but we'll do all this stuff when I get back. So I went to the retreat. My father had passed by this time, and I was really grieving over my father. And when I went to the retreat, it wasn't a retreat specifically for grieving. It was just an overall personal development course that was being put on by Tony Robbins. And during this process, we went through this closed eye process where the lights were down, and he's walking you through regressing the person into your past life, to let go of a lot of the emotional stuff that you've been holding on for years that was keeping you from moving forward in your life now and in the future. And during this process, it's extremely intense, and the lights are down, and everyone, it's 5,000, 10,000 people in the room, and they're all yelling and screaming and crying, and they're rolling on the floor. It's kind of, your first time you ever been to one of those things, you'd freak out hearing all this stuff. But then after that, all of a sudden, the music changes, and then they make it more dramatic and it's exciting, and they're giving you all the possibilities. Tony's talking about all the possibilities that could possibly have in your life if you let go of all this BS you've been holding on to. BS meaning belief systems, right? And you're holding on to these BS, and you let it go, and you see where your life could be. And then the lights came on, and everyone's celebrating, and you're screaming and yelling and jumping around. And I'm screaming and yelling. I'm jumping around. I'm like, hey, wait a minute. My pain is gone, because during that process, I'd seen my father at the weakest, the lowest point of my life, where things couldn't get any worse. And I saw my father in heaven, and his hand came out of heaven and said, Emile, it's going to be okay. And his hand went right into my heart. My pain went away. And it never came back to this day. And that was in 2007.
So somehow the pain of your father, you converted that into, or your unconscious converted that into a physical pain.
Absolutely. So that right there it got me starting to think that my pain was attached to an emotion. And I started looking back at another episode that happened in my life. That was a groundbreaking episode that I didn't understand back in 1989, but I certainly understand it, when this happened to me at the Tony Robbins event, and then also how I've progressed. So in 1989, when I was a surgical resident, specialized in urology, and my chairman and I, we went down on a medical mission to Haiti. And we were in Haiti for about a month, and we were the only surgeons that were in this geographical location up in the mountains of Haiti, about 4 hours out of Port-au-Prince. And, this is way back in 1989, and, we're driving through the jungles and stuff, and all of a sudden we get to near the hospital. We're seeing this line of people, and they were all waiting for us. And, we were supposed to be going there to do urological procedures, but we were doing everything from A to Z. I mean, appendectomies, removing tonsils, taking out gallbladders, whatever the people needed, we did it, And so the thing about it was, at this hospital, they were so short on supplies, they did not have any medications to give general anesthesia. So we were having to do a lot of these procedures with local anesthesia or with spinal anesthesia. It was a major abdominal operation, like if we were having to take out someone's, part of it, one for colon cancer, or work on the prostate, or take out a kidney or something. And the thing that was amazing, that these patients, post-operatively, all they were given was 2 to 3 tablets of Tylenol, and that was it, because that's all they had. And I remember I was making rounds that night after we'd operated on a bunch of people, and none of the patients were complaining. Matter of fact, they were up walking around or having dinner and with their family members, and I'd ask them how they're doing, and they're like, "Oh, I'm fine." I was like, "Aren't you having any pain?" "No, I don't have any pain at all, doc. I feel just fine." And I'm thinking, wow, United States, people be crying and screaming and trying to sue you and everything else,
Getting our
for
Percocets and our Oxy and
give my
whatever else.
and I need my sleeping pill. But none of these people were complaining. And I asked the nurse, I said, her name was Antoinette. I'll never forget her. I said, "Antoinette, why aren't these patients complaining about pain?" And she said, "Oh, Dr. Allen, it's because they knew that they had to have these operations, so they prepared their mind."
Wow.
And it's like, they prepared their mind. And so that always stuck with me way back in 1989, even though I didn't know what that really meant. They prepared their mind. But I knew that when I used to play sports, and I played football and soccer, and I get hit and banged up and knocked down, or you twist the ankle or something like that, and you just kind of shake it off, just like most kids do. You shake it off and you go back and play the game. And it's the same thing. I distracted myself, or a person distracts himself away from the injury, and then you're able to play the game. And then when you start thinking about the injury after the game, then it starts hurting again, right? So I felt, well, that's what they were doing. And it was at that, fast forward back to the Tony Robbins event. It was at that event when my pain went away and I realized this emotional connection with chronic pain. I realized that what the mind expects, the mind accepts. So I'll say that again. What the mind expects, the mind accepts. Because we have two minds. We have the conscious mind, which is the brain that's in between our ears. Okay. And that conscious mind is very logical. It's very analytical. It has to rationalize everything. And if it doesn't make sense, well, you'll make up a bunch of lies and whatever you got to do in order to make sense. We see it all the time in politics, right? And a lot of other aspects of our lives. However, it's a very weak mind because it uses willpower. And you just think about all the New Year's resolutions you've ever made, or so, anyone on this podcast has ever made. And yeah, it lasts a couple of days, couple of weeks, and then you're right back to the same stuff that you were doing before. But then we also have our subconscious mind. And the subconscious mind is everything else within our body and around our body. It's how we have 300 trillion plus cells that have over 6,000 receptors on them. And they're all on each cell, there's over 6,000 receptors on each individual cell. And all these 300 trillion plus cells are communicating with each other, and they're talking. And the way we know this is because there's been a lot of research. There's one lady named Candace Perth, who's a biochemical engineer out of Washington, D.C. area. And and we know that they're communicating because if you, let's say, are in a coma and you're in the ICU, well, the brain is not functioning. The person is unconscious. They're in a coma and they're not able to communicate. They may be hearing what you're saying. They may not. We don't know. However, subconsciously, the physiology of the body is still running. All those 300 trillion plus cells are still working. And the lungs are still, exchanging oxygen with carbon dioxide. The kidneys are still working urine. You're still got your GI tract is still functioning. The muscles can still move around and twitch and do whatever it's doing. Liver's still functioning. So even though the brain is not working, the subconscious mind is still running the physiology of the body. So that's another point that's so important to understand, is that the physiology of the body is run by the subconscious mind, not by the brain. Okay. So that was just another concept or understanding that was very clear to me.
Yeah, in your book, which we haven't mentioned yet, your new book, which is The Pharmacy Within, you talk about mental expectancy, which is what you just referred to right now. Right?
Yeah. So the mental expectancy is what the mind expects, the mind accepts. And I learned this mental expectancy when I was doing my travels through Haiti And it was a lesson that I learned after reflecting back on what I had seen there, and then also what I had experienced throughout my life. So, unfortunately, pain is, there's this general belief that has persisted throughout society that pain is directly proportional to the severity of an injury or a disease. And also, there's this other thought that pain, it won't go away unless the injury or the disease resolves. And then also pain can only be effectively treated by a physician or through medications or medical interventions. And this is all wrong. It's all BS, okay? And it's because it's the training that physicians have been taught throughout medical school of what chronic pain is, meaning chronic pain is a disease that is of unknown etiology. Well, chronic pain is usually caused by a chronic illness, which most chronic illnesses it's a disease of unknown etiology. We don't know what's causing the chronic illness, like autoimmune diseases, things like that. And it's when the disease or the injury occurs and there's pain that lasts greater than 3 months. It's kind of like the general definition. There's other definitions out there, but that's general. And it's pain that lasts more than 3 months, and it doesn't go away with the normal feeling of the disease or the injury. Whereas acute pain is pain that usually lasts less than 6 weeks, and it goes away with the healing of the disease or the injury. Okay. Now, what so many people do not understand is that chronic pain can layer or develop or overlap acute pain. So an example would be like someone with inflammatory bowel disease. They could have recurrent bouts of their inflammatory bowel disease, like ulcerative colitis or Crohn's disease, and they're having inflammation and cellular damage, and that's causing their acute pain. Mm-hmm. But if that acute pain becomes associated with or linked to a emotional event or some type of emotion within the body, then all of a sudden that acute pain can become chronic pain. Now, here's my point.
You can go crazy with that particular topic, by the way. In people, you're unconsciously creating this pain in your body, right? I mean,
I'd like you to say, instead of saying unconsciously, it's subconsciously, because to me, unconscious, you're just out of it. You're in that coma. You're unconscious.
Okay.
But your subconscious, it is working all the time while we are awake, driving a car, driving a race car, skiing down a mountain. Your subconscious mind is always working. We get this muscle memory and all these different things. Let me go a little bit step further so you can understand how this happens. So first of all, we've been talking about chronic pain. I'm using the terminology chronic pain because our audience needs to understand the difference between acute pain and chronic pain. However, I do not like using the word chronic pain. And I don't use the word chronic pain when I'm working with my clients who work with me over Zoom to relieve their chronic pain. I use the terminology conditioned pain. And here's the reason why. Chronic pain is not chronic pain. It's conditioned pain because you cannot just treat the pain in chronic pain. You have to treat all these biological impacts, the psychological, the physiological, the socials. And so if I'm going to use this example of a puppy. If I had a puppy, and random little puppy, just got the puppy home, he's cute, he's running around chewing on my shoe and pooping on the floor, and you're trying to get this puppy to become more behaved, right? You're going to teach the puppy how to sit. So the first thing you're going to do is teach the puppy how to sit. And you'll have a treat. Well, first of all, if you just said sit, puppy, sit, 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 puppy has no association. They have no idea what this word sit means. They're still running around chewing everything up. But if you pick up a treat and you say, sit, and then You move your hand with the treat above the puppy's head. The puppy will move its head up in the air, and to see the treat, their butt is automatically going to go on the floor so they can get a better
Ah,
angle at seeing it. And as soon as they sit, you give them the treat. And you do it again. Sit, give them the treat. Sit, give them the treat every time they sit. So the treat is the stimulus, or a conditioned stimulus, and the sitting is a physiological response, or a conditioned physiological response. So when they link up the treat with the word sitting, then all of a sudden it becomes conditioned. When doing it over and over with repetition and intensity, then it becomes conditioned. So let's think about that. I was doing sit, sit. So what did the puppy learn? The puppy learned that, number one, if they see me move my hand up, there's a treat in there. They're gonna want that treat. That's a conditioned stimulus. Moving my hand without the treat, they're gonna automatically sit because they're gonna think they're gonna get a treat. So that's a
right.
conditioned stimulus. Me being in the room and saying the word sit becomes a conditioned stimulus, and they'll sit. Me just seeing me and the puppy thinking, hey, I like to get a treat. I'm going to go over in front of Emile and sit, and I'm going to get a treat. So even though I was trying to teach the puppy how to sit with the word sit, they linked up 4 other things, maybe 5 or 6 other things that were totally unrelated to what I was doing. It just happened to happen. So that's positive reinforcement. Now let's look at negative reinforcement. Back in the day, some people would do negative reinforcement to train puppies. And they would say, puppy, sit. And the puppy's looking at it. Puppy doesn't know what it means sit means. So instead of them giving him a treat, they would hit the dog, maybe slap him on his butt and say, sit,
Uh,
or grab him by the neck and pull him up and push their butt down and say, sit. And they kept doing that. And if they beat the puppy or they're aggressive with the puppy, well, then the puppy's going to develop all kinds of behavioral problems, such as they might, start to coward. They might hear, every time they hear the word sit, instead of sitting, they're running over to, hide, or they roll over onto their back, or they start peeing on themselves, or they start chewing their paws with anxiety, or chasing their tail. Okay. But of course, that only happens with puppies, right? Okay. So we
right.
see this in humans all the time, with abused kids. Okay. And they develop behavioral problems, or abuse adults who've gone through some types of trauma, and they develop behavioral problems. Okay. And again, just like with the puppy in the first example of me trying to just use the word sit to teach them how to sit, they linked up on their own, lifting the hand, me being in the room, them thinking about it. So if you think about it, it's the same thing for humans. Humans are no different than any other animal. Okay. Humans will link up and overlap other types of stimuli that they're exposed to, and can be associated with as a conditioned stimulus, causing the conditioned response or physiological response of pain. So that's why I don't believe we should even be calling it chronic pain. I think there should be acute pain and there should be conditioned pain,
Now,
and
is
get
there
rid of the
like,
word pain.
are there like, in examples like this, I often hear people with, backaches, or they have strained neck or something like that. Are there more common conditioned pains that you come across, more common than others?
Well, as a medical hypnotist, I look at all pain as the same. Because one of the things that, unfortunately, over the past 100 years or so, and it's really bad now, is that as physicians, we try to put, all doctors into different silos and all diseases into different silos. So you have all these specialties. Okay, so
Yeah.
a cardiologist can't know anything about nephrology, or a urologist can't do anything, with the lungs. I mean, we specialize doctors so much that the right hand doesn't know what the left hand's doing. And so I don't like to think that, okay, well, someone's back pain is going to be different to treat that back pain than it is to someone who has phantom pain from having a limb amputated. Okay. Conditioned pain is conditioned pain. Now, everyone's conditioned pain is as individual as their fingerprint, and we have to address that issue. But the process of dealing with conditioned pain is the same. It's similar because conditioned pain, it's, I was going to mention this. Let me get my note here. Okay, so because conditioned pain, it's formed by the subconscious. Mm-hmm. Okay, and it's formed by the subconscious by making a link between negative emotional events or negative emotions, and it has, and like I had mentioned before, that the physicians, the medical definition, they feel that it's pain that lasts greater than 3 months. But here's the thing: conditioned pain can occur instantaneously. It can happen right at the time of the event. It can happen as soon as you're in the car accident. You can be linked up to have conditioned pain at that time, and that pain can last for decades.
So, in the example that you used, like when your father passed away and you had the shoulder pain, I mean, there really is no tie between your father passing and your shoulder pain, right? So how does that convert to that kind of pain?
Well, that's the thing. We don't know that only way that there was actually a tie to it. There wasn't consciously a tie where I knew, oh, this was because my dad passed away and I had shoulder pain. At some point in time, my subconscious mind linked up this emotional grieving that I was going over the fact that my dad was going to pass, and then my dad did pass, and it linked up with pain in my shoulder. But that wasn't a conscious process at all. That was a subconscious, so it was very indolent, right? And it wasn't until after I grieved and I got over the aspect of my father passing, and I saw my father's hand come into my heart, and I knew my dad was always here, that the pain went away, and I was able to realize, no, this pain was linked up to losing my father.
Yeah.
So I don't want people to kind of overthink a lot of that aspect of where is this coming from. Instead, you just got to understand where it's coming from is just from your subconscious. Conditioned pain is a subconscious process. And because it's subconscious, we can use hypnosis in order to help relieve it, manage it, and resolve it. Because hypnosis is... Mm-hmm.
Yeah, I was going to say, let's talk about hypnosis. I mean, you usually hear about, hypnosis with the show things and people clucking like a chicken and all that kind of thing. And, I do a little bit of like productivity hypnotherapy with my clients, and I have a really good friend who does past life regressions and things like that. But you're the only person that I know that does for pain management, which I think is very specialized and very highly trained to be able to do that. And so can you speak to that?
Sure. There's a lot of different definitions for hypnosis, but this is how I tell my clients what hypnosis truly is, because I feel it's the most accurate and the easiest to understand. Hypnosis is simply the language that we talk to and access the subconscious mind. We bypass the conscious mind so that we can access the subconscious mind in order to get to the part of the mind that's running the physiology of the body. So if we know that conditioned pain is coming from the subconscious mind, it's a physiological process, then we use hypnosis in order to access and talk to it. Okay. And we can make some changes that are occurring from these physiological pathways or these conditioned stimuli that are causing the physiological responses of pain inside the person. What hypnosis is also for people, and which they don't understand, a lot of people don't understand, is that everyone goes in and out of hypnosis every single day, whether you know it or not. If you daydream, you're in hypnosis. If you're driving a car and you go past your exit and you're like, a mile And you're like, oh man, I missed my exit. I can't believe I was, thinking about something
Or you
else and missed
don't
my
miss
exit.
it and you think, "How did I get home? I don't even
Right,
remember taking the
right.
exit,"
And
right?
that's all, and because we drive our cars subconsciously. If your mother ever sang a lullaby to you when you were a child, she was your very first hypnotist, and you went into a state of hypnosis. So people go in and out of hypnosis throughout the day, and so anyone can be hypnotized. What hypnosis is not mind control. It's not, someone doing hypnosis to you. Every person is doing self hypnosis. The hypnotist who might be facilitating the hypnosis is just the guide. They're just talking to you, but you're the one who's deciding to believe these suggestions and allow these suggestions to relax and be able to go into your subconscious mind and allow yourself to but actually a increased self-awareness of your surroundings, because people think that hypnosis is sleep. It's not. The hypnotist might use the word sleep to put you in a hypnosis, but you're not asleep. You actually have an increased sense of awareness of your surroundings, what you're hearing, what you're doing. And like when I'm doing regression work with people, their eyes will be open. I'll be talking just like I'm talking to you right now, but they will go back into past life memories in early childhood or in the womb or even before they were even born, and we'll resolve a lot of issues that's going on with them. And they'll literally be talking to me while I'm talking to them, but we get them all resolved. And all of a sudden we find the initial sensitizing event, which is what most doctors consider a root cause, but they don't, most doctors don't understand what a true root cause is.
So our
You got to
subconscious basically stores everything.
it's a gestalt. It's a gestalt of memories that is stored into anywhere between conception through around 4 or 5 years of age. That's where we will have what we call an initial sensitizing event that leads to other events that get stacked on top of that ultimately have a tipping point and lead into a chronic illness slash disease that or can lead into chronic pain slash condition pain.
Hmm.
Yeah.
So sometimes for condition pain, are you doing regression? Do you always do regression or not necessarily?
So there's two different things going on here. So one, if I'm doing work with someone on Zoom calls, I'm just doing pain management. So we're teaching the person how to manage the pain, and I'm teaching them how to relieve the pain and make that pain. Maybe it's a 5 or 6 at the time that we're doing our session at the beginning of our session, and we always have the goal of ending the session with the patient or client pain at a level of 0. I never end a session unless the level of the person's pain is a 0, because that is a convincer to let the person know, hey, you're 2,000-3,000 miles away, or you're on the other side of the world, and I'm just a guy talking on a Zoom call, in the metaverse,
Yeah.
basically. And you just made your pain go away. You put yourself in hypnosis. You made your pain go from a 6 or 7 down to a 0.
That's so interesting. And so like I have a dear friend, his name is Jason, and he has well, he would say it would be chronic back pain, which is caused by I guess it's a slip disc. And he's actually gone for stem cell on occasion, which has helped him quite a bit. So I mean, what happens if it's a disc or something that keeps changing in your body? How does that work? I mean, is
Well,
your subconscious causing that disc to keep slipping?
no, that's a physical problem where the disc is coming out of space between the vertebra, and then so it's coming out of the space between the vertebra above and vertebra below, and then you have a disc in between, and that disc is coming out and it's hitting along your spinal cord, one of the nerve roots that are coming out. So it's causing
Mhm.
pressure on that nerve root. Let's say it's down in the lumbar spine, and that's causing pressure, and now it's affecting your sciatic nerve that's down in your butt and your leg, right? That's a
Mhm.
very common thing that people have. So I'm glad you brought this up, because this is a great example. He has what would be acute pain on top of conditioned pain. But yet the physicians and your friend think they just have chronic pain because he's had this back pain for months, right? Or maybe years.
Years, yeah.
Okay, for years. So they'll say, oh, you have chronic pain. So now he's got to go stem cells. Now he's got to go get the, steroid, cortisone injections. Now he's got to go get the nerve blocks. And that has shown through medical research that none of that stuff really works long term. And if it does work, here's the thing, if it does work, it's probably due to placebo. Okay. We talk a lot of the medications that we take orally or through injections. Again, it's mental expectancy that the medication is going to work and help make me feel better, right? So that mental expectancy is the placebo effect. And that's why we get anywhere from 35
Wow.
to up to over 50% placebo effect on any drug or procedure that we do. There's been studies where sham operations were done for, let's say, arthroscopy on a knee. And the person has chronic knee pain, and they do operation on the knee, and they just make the incision, and the person's asleep, and they make the incision, but they don't do anything. It's the SAM part of the operation. They don't do anything, and then they just close the incision up, and they're done. They never put the scope in, but the patient believes they went in and they cleaned everything up and fixed everything, and then their pain is gone, and they're able to walk, and they're able to do fine. Whereas people who have actually had the surgery and they're still in pain post-operatively. So the placebo effect, and there's research out there, you can look it up on Google or whatever. The placebo effect is just as powerful as the medications or the procedures themselves. So we have to always consider that when we're working with someone.
That's like so interesting. So when they're testing, for example, a new drug, and I know that I have, a family member that was going through, you don't know if you're going to get the placebo or if you're going to get the actual drug and this new drug that they're testing. I mean, it's because they're measuring the effectiveness, right? Really of your subconscious, right? How much of it is it that is it really the medicine, or is it that you're taking care of whatever's going on?
That's exactly right. And so in most studies, not all, but in most clinical trials, they will always have a control, which is the placebo, and then they'll have the medication or the procedure that they might be doing. And so there's always a certain level of a placebo effect when you are doing any type of a clinical trial like that. And the thing about it is, in medicine, they tend to always dismiss the placebo aspect of it, and they only look at the clinical aspect of what the synthetic drug is doing or the surgical procedure is doing. When you think about it, we're missing out on the most important and most powerful, groundbreaking aspect of our lives as human beings, and we can if we don't look at what the placebo aspect of how our bodies are able to heal within, how our bodies are able to control conditioned pain, how those biological impacts are affecting the conditioning that's occurring. So with your friend not only has acute pain of that disc compressing on a nerve, but on top of that, because he's had this for so many years with the intensity of when he has pain and then the repetition of this happening to him over and over again. And then he's going to the doctors, and the doctors are saying, you're going to need this medication, you're going to need this procedure, you're going to need these stem cells, you're going to need this. And then you're going back home, and then your wife or your girlfriend's like, oh, poor honey, I'm so sorry to hear this, and blah, blah. Think about it. It's the treat. It's a treat like the puppy. They're getting stimulated by all these different treats, these different things that are compounding or validating, convincing of why he has pain. And the subconscious mind is just picking it up. It's like, okay, well, we're going to continue to have pain because, hey, I'm getting some codependency over here from these doctors. I'm getting some codependency from my spouse. I'm getting, hey, I don't have to do work. I don't have to go, I got workers' comp. I don't have to go into work. whatever it
Well,
is. I'm
he's
not
like
saying,
he's like a workaholic, so that does yeah, that
yeah,
part's not him.
I don't know your friend's
Yeah,
whole story. I'm just using this as an
yeah.
example for a lot of different people. There's a lot of people that won't go back to work when they get in a car accident and they have whiplash injury because they're getting workers' comp. So there's no incentive. There's a secondary gain by not working. And then that secondary gain feeds into the condition pain. So these are all the little aspects that, as an experienced medical hypnotist needs to think about when they're working with someone who has condition pain.
So you are releasing on Amazon your newest book. I think about the same time the podcast is going to go out. The Pharmacy Within. That's the name of your new book, correct?
Yes, The Pharmacy Within, and you can pre-order a copy on thepharmacywithin.net on my website, and the website is being revised right now. Yeah, with The Pharmacy
Wow,
Within.
awesome.
Mm-hmm.
And so you talk about the things we're talking about right now and how you can actually heal yourself from these pains.
Yes, you can, and the book is explaining through step by step, easy to follow examples, stories, and taking you on a journey of what chronic pain truly is. It's conditioned pain, how conditioned pain forms, and then talking extensively about mental expectancy and how the subconscious mind drives this whole process around conditioned pain. And most people would think, oh, well, gosh, my doctors couldn't fix me, and I've done all these, medical medications and medical procedures and interventions. And they think that there's nothing that can be done. But to me, no, this is really great news. We can do something because we know that the pain is coming from your subconscious mind. If it's coming from the subconscious mind, we can use hypnosis because hypnosis, if we bypass the conscious mind, we can access and communicate with the subconscious mind, the mind that runs the physiology of the body. Pain is a physiological process. Therefore, we can make the pain relieve or resolve. Okay. So that's what I do over and over and over with people. And it's just like training the puppy with the treat. We got to retrain the subconscious mind to say, hey, you know what? I don't need to live with this pain anymore. I don't need to even have this pain anymore. I can go on and live my life and be pain free. So one of the things that I always get my clients to do is as soon as we get them from a 6 or 7 down to a 0, after each session that I'm working with them, I was like, okay, you're a pain-free person. I don't want you going back and starting to, bring back that pain or thinking about the pain. If you tell me you're pain-free right now, well, go out and do things that pain-free people do. Go for your walk. Go for your jog. Go on your little bike ride. Okay. And then what that does is it reinforces and causes repetition in a positive reinforcement way to say, hey, I can do these exercises. I can live my life pain-free. I don't have to worry about walking around with the cane or worrying about if my back's going to go out because I'm afraid, it might go out again if I stoop over.
Or I pick something up or something like that.
Right.
How interesting. And I just want to ask you one other quick thing, which I know that we're talking about conditioned pain. There are also some, like Deepak Chopra, right? There are people in the belief camp that you can actually cure diseases in your body as well with your subconscious mind. Do you have any thoughts on that you care to share?
Absolutely. So, yes, I do believe that you can cure certain chronic illnesses / diseases with your subconscious, and you definitely can put them in a remission. When I do that, I'm always working with someone doing regression work. And so when we regress someone back into usually around 0 to 5 years of age, we will find what the initial sensitizing event is that causes cascade of events in that person's life that's causing them to have the chronic illness that they're having today. And it's all a subconscious process. And when we relieve that or resolve that initial sensitizing event, all of a sudden their disease goes into remission or it goes away. So I've been doing this for over a decade now, and it's a consistent thing. It's something that we see all the time, and it's a lot of work, but it's very, very satisfying work.
Wow. Well, no, that's really great. And for any of the listeners that would like to reach out to Dr. Allen, I have a website here, drugfreepaintherapy.online. Is that correct?
Actually, it's just thepharmacywithin.net. Just go to thepharmacywithin.net, and you'll be able to contact me or get a copy of my book.
Perfect. And you do actually meet with people via Zoom? So I know that you're traveling. You're a bit of a gypsy yourself. And I know that when I've tried to reach you before to get you on the podcast, you're there in Dubai, or you're in Europe, or you're here, or you're there. And so it's kind of hard to get you. But when you do, you are able to get you online.
Absolutely. Yeah, I can work with someone anywhere in the world. So when I'm traveling to go help someone in person. And then in between working with them in person, I can work with people over Zoom for pain management aspects.
Awesome. Well, thank you so much for being here. And listeners, thank you for joining us today. Again, if you have any questions, we're going to have that all in the show notes on how you can reach Dr. Allen. And you can also email me, and I'm happy to pass along his information. And one more question. This is the I Love Me Lab. So if you're going to give one little nugget of wisdom to people on ways that they can show themselves self-care and self-love, what would that thing be?
I would tell you that everyone on this earth is a miracle. Okay, when you think about it, out of one sperm from your father and one egg from your mother that joined together, you were created. So you were already a miracle. And then when those two cells came together, a soul went into you and it created you. So never underestimate the power of your subconscious mind. Never underestimate the power that you have and the ability in order to manage your condition pain.
Well, thank you so much, Emile. Sending you and sending all the listeners a big heart bomb. And we'll see you next week. Thank you.
Thank you. Bye-bye.
Thanks so much for listening to this conversation. If you enjoyed it and want more information on our guests and resources, please visit ilovemelab.com. And please, if you enjoyed this episode, remember to subscribe and share with a friend. Hey, there's more great episodes to come. So until next time.